Good evening. The Secretary of State for Health says he's worried and troubled by allegations of a toxic culture at University Hospitals Birmingham. In a letter, Steve Barclay said claims of those blowing the whistle at UHB, one of the biggest trusts in the country, must be acted on. It follows a joint investigation between our health correspondent, Michele Paduano, and the BBC's Newsnight programme. The union Unison says it produced a dossier 18 months ago highlighting concerns about bullying. The trust denies mistreating staff and says patient safety is its highest priority. Here's Michele.
John Watkinson was one of the country's top ear, nose and throat surgeons, but he was accused of shortening the lives of 3 patients, suspended and investigated. The GMC investigation was closed with no further action and he received an apology from his employer, but it took 6 years.
You feel depressed, you question life, you wonder where it's all going. Alcohol becomes a big factor and suicide raises its ugly head.
The Trust says it stands by its decision to suspend Mr Watkinson, saying it was appropriate after a colleague raised significant concerns. Between 2012 and 2020, 26 doctors of the Trust were referred to the doctors' regulator, the General Medical Council, but no action was taken. The BBC has learned that another surgeon, Neil Howell, seen here doing a heart transplant, was one of them. He hasn't operated for 5 years, doesn't appear on the Trust website, but has been paid throughout. UHB says it stands by its investigation, but cannot comment on a current employee. In 2020, the union Unison was involved in a dispute about porters, but was approached by doctors with claims about a hospital culture of fear. The regional secretary was so concerned that he prepared a report for the Care Quality Commission. It highlighted similarities in culture to the one that led to the scandal at Mid Staffordshire.
Patient care scandal at Mid Staffordshire was there in the back of our mind. In the report we actually make reference to the Mid Staffordshire inquiry and quote some of the Francis report, and we draw the parallels between Mid Staffordshire and UHB.
The Trust says it hasn't seen the report, denies mistreatment of staff and says patient safety is its highest priority. The CQC said the issues raised were robustly covered in its last inspection and form part of the judgment on how well led the Trust was. Managers in Partnership, a partner union, contributed to the Unison report. They also supported Sophie Wheely, who in a 20-year career became head of informatics, the study of health data. She now works part-time in a supermarket, having lost her job and her home.
I lost everything. Well, not everything. My children were still alive, but that was what kept me alive, was my children, knowing that, I couldn't take my own life because they would then have to live with that for the rest of their lives, and that was what stopped me from suicide.
Sophie disagreed with the management decision and sent an insubordinate email. It was later identified that it was because she was bipolar. But despite knowing this, the Trust dismissed her. She won her employment tribunal for disability discrimination. She says her children saved her, but being unable to get out of bed or function, it damaged her relationship with her son Jack.
He eventually came to live with me for a number of reasons. His school was local to where I live as well, but I think it was a more stable environment in my house, really. So.
The Trust said Ms Wheely's actions had led to an irretrievable breakdown in confidence after she sent wholly inappropriate emails. Her disability didn't completely explain her actions, and she was 25% responsible. The Trust said it couldn't provide anyone for interview on any of the issues identified because of the pending independent review. Michele Paduano, BBC Midlands Today in Birmingham.
Well, the Health Secretary has been briefed about the allegations by NHS England today, and he's written to Preet Gill, Labour MP for Edgbaston, in reply to her letter to him last month. I spoke to the MP earlier today after she'd called for an independent inquiry.
Well, early in December, BBC Newsnight did a programme on University Hospital Birmingham, and subsequent to that, I've had over 50 whistleblowers from different levels of seniority across university hospitals, doctors, nurses, junior doctors, raising concerns of bullying and toxicity.
Now, you've written to the Health Secretary about your concerns. What do you make of his reply?
I was very encouraged. I mean, I think he takes whistleblowing very, very seriously. And as you've seen, the level of whistleblowing, is around patient safety. Clinicians are saying very often we are raising concerns and far too often actually we are being ignored, and that is a real concern. There seems to be a lack of transparency, accountability. And so, yes, it's really encouraging to see that the Secretary of State understands the importance of this. And whilst he says he wants to see things change, of course I do, we've got to absolutely make sure that we give the confidence to patients, to clinicians, that actually something is going to change this time and we are not going to continue as we have been before.
So are you going to push for an independent public inquiry?
Whilst I've been pushing for a public inquiry, it's clear that the Secretary of State has spoken to NHS England. Now, Professor Buick isn't from UHB. He isn't from the region. He's from outside. I am assured from my initial conversations with him that actually he wants to undertake a review that is as broad as possible, given the very short timescale that he has. Now, I want to see what the recommendations are. We don't yet have the details of the second well-led review or the third one into the kind of culture, and I want to see some of the detailing before that. But I want to be assured that it is going to be independent because, of course, it must be.
And it has to be pointed out that the Hospitals Trust are very keen to impress that they deny all these allegations about the culture.
This is an opportunity for the Trust to really showcase leadership because there's been a clear failure of leadership. The communications is not adequate enough. Staff morale has been really difficult. The CQC has come back and given an enforcement notice. And what does the enforcement notice mean? It means on the day that they turned up, when they looked at the rota, the adequate staff were not in there. Now we are facing huge strikes. So if on a normal day we don't have the staff to meet the needs within the hospital, I mean, that is really, really worrying, and it's a very concerning situation to be in.
Preet Corgill MP. And there's more on this on Newsnight on BBC Two this evening at 10:30. And if you've been affected by any of these issues, there's help and support on the BBC Action Line. A third man's been charged with the murder of